I thank the chair, and I would first like to add my congratulations to our colleague, Ms. Presley, for the historic nature of this hearing. I wish attendance were better, because every one of my colleagues needs to hear your testimony. And not just, as often happens in Congress, not just pay it lip service, because this is pretty rare to have an entire panel that's genuinely on the side of children, the angels. It's also pretty rare to have an entire panel these days that's on the side of science, which translated means government-funded research. So people have to get over it and support it. I have a particular need to single out my friend and colleague, Mr. Henry from Tennessee, a remarkable public servant. Now, how he ever overcame the handicap in Madison, Tennessee of having been raised by, I'm guessing, 50 Republican relatives, that's quite, that might be an ace, I don't know. But his career in our state legislature, where he was a giant, his career in the business community, serving the underserved, his career in the executive branch, not only in the cabinet, but as deputy governor, is extraordinary. So I thank you. I wish we had more people like you. In fact, if you want to run for office in Tennessee statewide, since Democrats have a difficult time doing that, you might be the best we can get. You know, so. But I don't want to hurt your campaign with an endorsement right now. But the elephant in the room is this. Can we really help our kids in states that have refused to even extend Medicaid? Mr. Henry worked hard. Governor Haslam's Insure Tennessee plan, which you and I were both strongly for, but our legislature would not even give the time of day. So our state is giving up $1 billion a year in health care for poor families, mainly kids. So I would first like to ask our three doctors on the panel, is it possible to help kids, as you suggest, in a state that refuses to even extend Medicaid and to give up all that money that could be used for health care for these poor families? What is the answer to that question? Because that is politically the most pressing question that at least 14 states face.
And my response is not political, it's just human. As a physician, I have seen when a child really needs help, that because they don't have the insurance, and for poor children it's usually Medicaid, they do not get the type of service they need, the quality of service they need. Unfortunately, what I have seen in another experience when I worked in forensics, where there were people on death row, and as a psychiatrist, I was asked to see them. I could get a lot of money at that point when all the damage had been done. And so I would like for us to really think about, and back to prevention, if for many of those men that I saw, the traumas that they experienced, if there had been access to health care at that time, and they perhaps would have been referred to some therapist, psychiatrist, psychologist, maybe they wouldn't end up now with someone like myself trying to get the mercy and not the death penalty. So we need to have our children have access to health care.
So I'd like to address your question from a data point of view, but first from a personal point of view. I was one of the first babies on Medicaid in California, and I was hospitalized 11 times and saw a lot of ER doctors, and I would be dead without Medicaid. There is no question about it, and I can tell you my story another day, but I would be dead. Now, I wish the providers were more trauma-informed because they could have done a lot to help my mother, which is really who needed help, right? So we need to integrate Medicaid services to be family-based, not only just for children, but to allow pediatricians and family physicians to cut across and help the mother or the father, because that is often what needs to happen. To help children, we have to help adults. Now, for a data picture, this is in my testimony written, there's wide variation across states in how many children have special health care needs based on whether they have ACEs. Wide variations in terms of whether they have emotional, mental, behavioral problems, bully, whether they're flourishing, whether their families stay hopeful in difficult times. And I can show you that in the states that do not have more generous Medicaid benefits, that there tends to be higher rates of these problems.
Thank you.
Thank you. Thank you, Mr. Cooper.